there like a direct connection that connects heart diseases with gum disease?
So there is this heart disease known as infective endocarditis.
Yeah.
There are people that are prone to infective endocarditis, people with prosthetic heart valve, people like with congenital heart disease, that's people that were born with certain heart disease. People like this who are quite susceptible to having this infective endocarditis. When they have periodontitis, that's the gingivitis, inflammation of the gum,
Yeah.
there's a chronic inflammation going on. So it becomes a systemic condition, especially when these bacteria get into the blood. It can travel to the heart and form like a vegetation in those valves.
Wow.
And cause that infective endocarditis. And even the bacteria that is implicated in that periodontitis, it can travel, once it gets into the blood, it can travel like far down to around the body. I know some research cases have said it has been implicated in arthritis. They've isolated like the bacteria from the mouth, the knee.
Wow.
They've isolated some like in case of breast cancer, stuff like that.
Whoa, from the mouth?
Yeah,
Like your
it
gum
wants
can-
it.
So what if I get to tell you that it's the simplest thing, like your gum can affect your heart? So it was funny when I found out about it, and today we're going to be talking about how your gum can silently affect your heart. Today we have a dentist with us today to explain what is the connection between your gum and your heart. On today's episode, we have Dr. Precious Ojuku. Welcome to the show, Doctor.
Thank you.
Before we continue, please, if you want to know what we're doing here, I would appreciate if you subscribe, like, and share this video with someone that might need it. So let's go back to Dr. Ojuku. So, Doc, what's our gum? Like, how is the gum in our teeth? How does it look like?
Well, your gum is the pink tissue that holds the teeth together. The one you can see if you raise your lip down, what you see is your gum. It's known as the gingiva.
Yeah.
The gingiva. Yeah. So the gum can get infected, and when that happens, it becomes gingivitis. So like an inflammation. Yeah.
So now, how does this gum silently affect our heart?
Well, it's not like a clear cut path. How when the gum is diseased, an inflammation happens, which is mostly due to poor oral hygiene. When this happens, you have gingivitis, and then there's a more severe case when gingivitis is not treated or controlled. You can get to a different level, a more severe case called periodontitis. So it's in this situation now where when this is happening, the gingiva is swollen, it's red, it's very prone to bleeding, especially when you brush. So when you brush and then there's bleeding, this bacteria can, get into the blood, say condition known as like bacteremia. And then when that happens, blood travels around the body. So this can get to the heart and, trigger some form of systemic conditions.
Wow. So now, what are the early signs?
Of gum disease?
Yes, of gum disease.
Yes, definitely. When you notice that you bleed when you brush, that's like the commonest telltale, the commonest sign. Yeah. When you bleed while brushing, that's the commonest sign. You feel that sometimes your gum is swollen and it's painful. When you're touching it, you're just feeling pain. That's the sign of gingivitis.
Well, so also I want to know, are the common cause of gum disease?
Yeah, it's generally due to poor oral hygiene. You're not brushing well. You have bad brushing technique. You don't floss properly. You don't visit the dentist for the professional cleaning. So all of this, you have plaque that just accumulates in your mouth. Plaque is How would I describe it now? You have, when you eat food substances, you eat, you rinse, your toothbrush can't remove everything very well. So every 6 months, you have to go to the dentist for them to do it properly for you. And that's why we also advise that people brush 2 times daily and then that they floss as well. Because we've noticed that a lot of people, they don't really know how to brush. They feel like maybe when they use hard toothbrush or when they use excessive force to brush, that they are doing the cleaning, but that's not what it is. There's a proper brushing technique that you're supposed to use. You're supposed to use medium textured toothbrush with fluoride and clean properly, brush twice daily. So when you don't do these things, this plaque accumulates in the mouth and then it leads to gingivitis. The gums become inflamed.
Or so now, people, all the people that use this hard brush, because you just said medium brushes are proper ones that we're supposed to use. All the people that use hard brushes, like why are they even in production? Why did they even produce hard brushes?
Because I don't know, people, it's just like cigarettes. They write it there. Cigarettes will cause lung disease
Yeah.
and they
So,
still make it and people still buy it. It's business.
oh, because like to be very honest, before I used to prefer like hard brush because I believe that hard brushes are the ones that do the cleansing very well.
That's what many people believe. No, it's not about it's about the technique of brushing. You have to go from, like, let's say this is your lower teeth. You have to go from down up and clean this way. And then for the up, you have to go down like this.
Oh, so
Yeah.
this.
Nah, that's wrong brushing technique. You're
Oh,
causing, you're causing more harm than good.
wow.
Yeah.
I was thinking that's the best way to clean your teeth. You just
Nah.
I don't know if you've seen it. People used to do like brush, 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 brush.
Yeah. Yeah. The brush really hard. You're injuring your gums. Yeah.
Oh. So are there any like toothpaste or like would I say chemicals in a toothpaste that damage the gum? So maybe people will be able to look out for this particular ingredient in a toothpaste that gets to damage the gum, which can also cause heart disease.
Not necessarily. What we look out for is the chemicals in the toothpaste, or what will I, not chemicals now, the product in the toothpaste that helps the gum, that helps the teeth, fluoride.
Oh, okay, yeah.
So when you want to buy like a toothpaste, you have to check for toothpaste with fluoride, toothpaste that have fluoride. So you check for those ones. The basic ones we have in the market, many of them have fluoride. So you just have to check the because fluoride helps the teeth, So when you just get a toothpaste, check if it has fluoride, and then if it does, you get it.
So now there's no like direct connection that connects heart diseases with gum disease. Is it like a direct connection?
Okay. So there is this heart disease known as infective endocarditis.
Yeah.
There are people that are prone to infective endocarditis, people with prosthetic heart valve, people who have had infective endocarditis before, people like with congenital heart disease, that's people that were born with certain heart disease. Some of these people, like people like this who are quite susceptible to having this infective endocarditis, when they have periodontitis, that's the gingivitis, inflammation of the gum,
Yeah.
there's a chronic inflammation going on. So it becomes a systemic condition, especially when these bacteria get into the blood, it can travel to the heart and form like a vegetation in those valves and
Wow.
cause that infective endocarditis. Do you understand?
Yeah.
Yeah, so we can see that that happens. And even the bacteria that is implicated in that periodontitis, it can travel, once it gets into the blood, it can travel like far down to around the body. I know some
Wow.
research cases have said it has been implicated in arthritis. They've isolated like the bacteria from the mouth, the knee.
Wow.
They've isolated some like in case of breast cancer, stuff like that.
Whoa, from the mouth? Like
Yeah,
your
it
gum
once it
can.
gets into the blood, it travels round. That's the thing. So like it's always very important to take very good care of your gum.
So now, why do most people underestimate oral health?
It's basically lack of education. And the early signs are not very painful. So they just feel like, oh, it's a small thing. They don't have the in-depth knowledge of it. It's a public health issue, you know.
So you think that there's a gap?
So yes, there is definitely there is.
So what are you doing your part?
Right?
What are you doing your part to?
If you notice, there's a lot of outreaches that we do.
Or
Dental, there's a lot of dental outreaches, a lot going on in the country. Dentists go to villages. Even when we were in school, our community dentistry, we go to different rural areas.
yeah,
We talk to them about their oral hygiene. We do free cleaning for them, and some minor treatments. We do that for them. So it's something that the public also, the federal government also have to put things in place for better education of the public.
yeah.
Because a lot of people in the rural area, they are not exposed to much knowledge and much dental clinics
Yeah,
as
true.
we are here.
Oh, okay. So now, are they food or like are they like nutritions that someone needs to take or vitamins that can help strengthen the gum?
What I would say is first of reduction of sugary diet. Sugary diet can cause cavity, and the gum. What helps the gum mostly is good oral hygiene. Do you understand? It's
Yeah.
just good brushing technique. That's the major, will I say, treatment now for the gum. That's the best thing the gum needs. Good oral hygiene, good brushing technique, regular visit to the dentist every 6 months. That's the
Are
major
they
help.
are they age like factors for people likely to have gum issues?
Okay, like gingivitis now
Yeah.
is common in both children and adults.
Both children and adults.
Yeah, but then the more severe case is not as common in children. It's mostly seen in adults because it's a chronic disease, so it
Mostly
takes
seen in
time.
adults.
Yeah, it's mostly seen in
So
adults.
what are the common like dental issues for children?
Common dental issues that are seen in children, we see dental caries. That's
Oh,
like
okay.
tooth decay. We
Oh,
see that in children. We see there's this enamel defect that can be seen in children as well. It's called the molar incisor hypoplasia. It's seen in a lot of children as well. And then even things as little as them suckling their tongue, to children that suckle their
yeah.
tongue and all of that, or suck their tongue rather. All this oral habit like mouth breathing, all these things can cause some dental problems in children. Take for example a child now that sucks his or her thumb. So like child is 5, 6 and is still sucking. You need
Oh,
to take the child to like a dentist so that they can put there's something called a habit breaker. They can put it for the child because when they keep sucking, it can affect the arrangement of their teeth.
wow.
Yeah, it does. So people I've noticed and we've realized in practice that parents, caregivers, they don't take the oral hygiene of their children very seriously, especially when they still have like their milk teeth. They feel like, oh, it's just milk teeth.
Yeah, true.
But the milk teeth is like really, really important because apart from the fact that children need to chew, they need to eat because this is like their developmental stage. When they start having all this tooth decay that's causing them pain, they'll not be able to chew properly. And this is also the time that they also develop their speech. So when their teeth is not in proper alignment, can also affect their speech. Also, another thing they feel is that since it's milk teeth, it will fall
Follow.
off
Yeah,
and
true.
then the permanent one will go. But what they don't understand also is two things. When this milk tooth gets infected and is not treated, it can also this affect the permanent teeth
Teeth.
erupting.
Wow.
Yeah, that could happen. And if you remove the milk teeth prematurely, it will also affect the positioning of the permanent one because the milk teeth is what guides the permanent teeth into proper occlusion, into it to come to where it's supposed to be, normal position that it's
Yeah,
supposed to be.
true.
So when it's not there to guide it, it can come out anyhow. Come out anyhow.
Oh,
And then the child just have scattered teeth.
oh.
Yeah.
Like also, this is the first time I'm hearing that children that sucks their hand used to affects their tooth.
Yeah. There's a thing called oral habits. It's not just the sucking. Maybe people, children who suck their tongue, children who are mouth breathers, who breathe with their mouths.
Whoa.
Yeah, all these things can affect the teeth.
So parents should look out for
Yes.
these things.
Yes.
Can you list them?
Like just maybe sucking, thumb sucking, lip sucking, tongue sucking.
Yeah.
Children who sleep and then they're sucking their tongue. Yeah, that as well. Mouth breathing, all of these things. There's a lot more, but this is like what I remember for now. There's a lot more. All these things when it's happening, when these things are happening, like maybe first year, 2 years, you're still thinking okay, but once you start getting to like 5, 6, 7, they need to stop it. They need to five. They need to go to the dentist.
Oh. So
Yeah.
now if you will advise parents now, like just three advice on how to protect their child oral health, is there any like talk of your three advice? If the parents comes consult to you today, first of all, how much is the consultation fee?
Anyways,
It's like the money is too much, but maybe I'll ask you backstage.
yeah. So the first thing we like to advise parents is to establish a dental home. What that means is like when a child is 1 year of age,
Yeah.
the child needs to start seeing the dentist, or within 6 months of the eruption of the first tooth. Once you've seen that, like the first tooth has erupted in the child's mouth within 6 months, the child needs to start seeing a dentist. Now, children should be supervised. You need to brush for children. I don't know. I think I've seen some parents where they'll tell you, "Oh, he doesn't allow me brush for him, or she doesn't want me to brush for her. She likes to do it by herself." This child is 3, 4, 5. You need to be brushing, like brush for them. And even when they want to brush themselves, you need to supervise. Do you understand?
Yeah.
And if you also need to reduce sugary diets for children, you need to reduce that, especially like in between meals.
Yeah. Yeah.
Do you understand? The frequency of sugar exposure can cause dental caries, you know, for the children. So if like now you keep two children here, it's not even just about the quantity of the sugar. You keep two children here, you give them 2 glasses of juice and then 1 glass of juice each, and then this person finishes hers in, let's say, 5 minutes, and this person finishes hers in like 2 hours. This person who finished in 2 hours is at more risk of dental caries than this person who finished in 5 minutes. Do you understand?
Yeah.
So it's the frequency of exposure. So we need to limit that frequency. You need to ensure that the child is brushing every morning and night supervised. Need to, whether the child has cavity or the child doesn't have cavity, the child always needs to see the dentist. People need to understand, especially in a country like ours, that the health of your teeth should not be an emergency. It should be a routine. You understand, you should visit the dentist routinely. not just when you have pain. Do you get?
Yeah.
Yeah. So there's that. People also need to understand that you need to change your toothbrush every 3 months. You need to do that.
Nigerians, I'm not sure most Nigerians change their toothbrush after 3 months.
Yeah, but it's really necessary that you don't have to wait until the bristles are like bending like this, you know, because at that point it's not doing the work.
Oh,
It's
true.
not doing what it's supposed to do. The bristles need to be sharp and clean. So yeah.
So, lastly, before we go, what is like one dental mind you like to correct here on the show today?
Okay. I mean, we've already talked about it. You said it yourself, but I'm just going to say that people feel like hard toothbrush is what does the work, or brushing very hard. No, it doesn't. You need a medium texture toothbrush, and you just need the right brushing technique. So yeah, that's a major myth that people think when they use hard toothbrush. Smoker's toothbrush, it will clear. It's not that's not correct at all.
Oh,
Yeah.
okay. Is there another one you want to give? Or it
Okay. I think also I already mentioned this as well. People feel like a milk teeth is just milk teeth,
makes it?
and so it's not very important. That it could just fall off. It affects. It's not just milk teeth. It's very important because it affects permanent teeth that is erupting. So yeah,
Okay. Thank you so much, Dr. Precious Ojoko. It's nice having you on the show.
you're welcome.
So at this point, we've come to the end of this show. If you want to support what we're doing here, please subscribe, like, and share it with someone that needs it, someone that does not take care of their oral health very well. So if you need to consult with Dr. Precious, you can send us a DM also, or send us an email. We'll get in touch. Like, we'll connect you both. Maybe after now, we'll put our consultation fee on the comment section, so in case you want to consult with her too. So, see you on our next episode. And thank you so much, Doctor, for coming on the show.
You're welcome.
Bye.